Medical emergencies in dental practice can occur without warning. Patients with underlying conditions, stress, and anxiety can trigger life-threatening situations. Every dentist must be prepared with knowledge, skills, and proper equipment. The most common emergencies include syncope, hypoglycemia, asthma attacks, angina or heart attack, anaphylaxis, and seizures. Each requires immediate, specific management. Quick recognition and proper positioning can be life-saving. Essential emergency drugs include oxygen, adrenaline for anaphylaxis, GTN for angina, glucose for hypoglycemia, and salbutamol for asthma attacks. Monitoring equipment and airway management tools are equally critical. Prevention through detailed medical history, vital signs monitoring, and stress reduction protocols significantly reduces emergency risk. Hospital settings provide advanced support, while clinics require basic life support training and immediate referral protocols. Every dental professional must maintain BLS certification. Preparedness saves lives and provides legal protection.